Welcome back. Time now for Real Men Wear Gowns. It's our campaign to get men to put on that hospital gown, get screened, be proactive, and pay attention to our health. Today we're zeroing in on an important but often overlooked aspect of diabetes, and that is how it affects really all of us, including, of course, men. Joining us now is Dr. Tyler Feldman with Franciscan Health. He's here to help us understand why we men need to be paying closer attention to our blood sugar, the symptoms, and our overall health. Dr. Feldman, thanks so much for being here. Really
Pleasure
appreciate
to be here.
it. So let's start off with the basics. What is diabetes and how does it develop?
Yeah, well, in simple terms, diabetes is a blood sugar issue, and insulin is like a key to a door. So when your insulin's working right in your body and your body's responding to the insulin well, it allows that sugar to get out of the blood vessels and into cells to feed them. But unfortunately, when there's insulin resistance, like in type 2 diabetes, the problem is that it's like there's rust on the door. And even though there is insulin and the key's there, it doesn't quite open that door well enough, so the sugar gets trapped in the blood. And instead of feeding cells, it stays in the blood and it damages blood vessels and causes a lot of unfortunate complications.
So in men specifically, is there anything that makes us more or less vulnerable?
Well, so men, when I did look at some stats, they do have a slight increase. It was about 2% more than females. So there are just more prevalence in males than females. So if you have a family history of diabetes, really important to be screened, really important to be checked. But there are things that we can do. So two main things would be making sure that your weight's appropriate, making sure that you have normal weight. And if you don't, trying to at least lose 7% of excess weight that you have. That will help combat insulin resistance.
Okay.
And the other thing is movement. And I just tell people, it's not like running a marathon. You just need to be moving around at least. You know, they say that moderate activity around 2.5 hours per week. You want to at least try to get a brisk walk in. So I would say walking with a purpose, 2.5 hours a week. So that could be, walking with your wife after dinner, and making something a routine. So inactivity is leading to a lot of diabetes, obesity is leading to a lot of diabetes, and then unfortunately genetics, which we can't control.
And this is personal for you.
Yeah, absolutely. So I'm a type 1 diabetic, so it's a little bit different than the insulin resistance type 2 diabetes, but when I was 14, I just stopped making insulin. And they said, here, take 4 shots a day. So, so I definitely have a personal connection to it, and definitely have seen with my patients too, just a lot of the nasty things that diabetes can do to a person and affect their quality of life. And I tell people that diabetes is an annoying condition. It's burdensome, but so are the complications of diabetes. So if you get it controlled soon, fast, and you can prevent some of those complications, your quality of life will be better.
Awesome. Dr. Tyler Feldman, thank you so much for joining us. We have a lot more to talk about because you can't squeeze a conversation about diabetes into like 3 minutes. So head to our full conversation online at WTHR.com/realmenweargowns. Much more there.
All right, time now 4:48 here on this